Legal aspects in ophthalmology is being published by ARC, and every member of the AIOS is having that book. And the legal things which are required for an ophthalmologist is all enumerated. That book is written by me, and it is circulated as a CME to all our members of AIOS. So this topic of legal aspects is very important because it is a necessity of the day. I am giving protection to all AIOS members through the legal cell, and any member who is being done against some law, like CPA case or criminal case, can contact me, and free advice is given from the legal cell of the AIOS. So by a medical practice, way of consultation, diagnosis and treatment, both medical and surgical, would fall within the ambit of service as defined in section 210 of the Act and comes under the CPA. So because of this section, the medical profession came within the CPA. Negligence of the doctor is defined as the breach of responsibility or duty owed to his patient, and which results in actual damage to the patient. So only the negligence is not sufficient. Negligence should cause the damage to the patient, and if damage is there, then there is a Consumer Protection Act comes in between to fulfill the damages. Negligence is breach of duty arising due to omission of an act or commission of an act which no prudent or reasonable doctor under similar circumstances would do. The doctor will not be held responsible under negligence if the treatment is as per the standard textbooks and or accepted professional practice and still patient suffers loss or injury. This is a very important thing in this, because complication is not a negligence. Merely because the complication has occurred, doctor is not negligence. So the medical man is not an insurer. He does not warrant successfulness of the treatment of the patient. The types of the hospital, very important thing is that the corporate hospital and trust hospitals, though they treat the patient free, but free patient of this hospital can go against the doctor for Consumer Protection Act because other patients are paying and the services are paid services. So the primary responsibility of the hospital is to maintain a strict precaution. Hospital has a vicarious liability for whole staff, nurses, doctors, anesthetists, surgeons. It does not matter whether they are permanent, temporary, resident or visiting full-time or part-time. So it becomes very important. Unless a qualified nurse is employed, it becomes negligence whatever she does with the patient. So it is required to employ qualified doctors and nurses. It is not a negligence if a nucleus drop occurs and the treatment not feasible, a day or several days or even weeks may be done. A patient requires glasses post-operatively if dislocation of the IOL takes place, if the patient does not follow the instructions of the doctor, and as a result, benefits of the operations are reduced or modified or give rise to complications. If eye surgeons performing YAG laser to rectify the vision defects causes RD, if patient gets heart attack while doing the minor operation, is not a negligence. So legal aspects in ophthalmology is published, which is with all members. Thank you very much.